Iontophoresis. We talked about how this is a form of direct current. Typically, your machine is going to be portable. These are the best units out there. They're older than dirt, but they're fabulous because they have 2-channeled outputs. So you could potentially run 2 different body parts or 2 different patients off of the same machine at the same time. Or not at the same time. You could start one and then 5-10 minutes later start the other one, and then one person could finish up and then the second person finish up. So completely versatile as far as Ionto is concerned. So we know that iontophoresis is utilized to deliver a medication into the tissue. Can anybody tell me why iontophoresis is a little bit different from phonophoresis? It uses electrical energy, yes.
And it has to be compatible with the, what's it called, the polarity of the...
Yes. Your medication has to be ionized. It cannot be a neutral. So whereas with phonophoresis, it doesn't matter if there's a charge to the medication. Phonophoresis, you can use like hydrocortisone cream or whatever the doctor has recommended to use. Usually it's like a dexamethasone or a hydrocortisone. Hi, can I help you?
I'm here for the kinesiology lab.
Across the hallway for Dr. McAuliffe?
Yeah, I'm already lost.
That's okay. If you just walk straight across, it's going to be the door on the right.
Okay, thank you.
I made it on the video.
So the other thing is that it has to be ionized. So there has to be some sort of a charge for your medication for Ionto to work. With Phono, it doesn't have to have a charge. It can be neutral because the sound waves are just going to push that medicine down into the tissue. But Ionto works differently. So you'll notice on this particular machine, you have 2 channels that come off of it. And this one is set on the outputs. This one has a little plus on it, so it's your positive one, and the black is your negative on this one. So if I used a negative medicine, which one would I utilize for my medicine wire?
The negative one.
Yes. Why do we need to use the negative one on a negative medicine? Because opposites attract and like signs repel.
Mm-hmm.
So if I take a negative charge and I put it
Push
on
it
a
down.
negative
Mhm.
medicine,
Yeah.
it's going to push that medicine down into the tissue because they're going to repel. So you have to remember and you have to know what your polarity is of your medication, okay? Likewise, if I was using a positive medicine, I would use this on my medicated patch for my positive pole, okay? And then I would use what we call a dispersive on the other electrode. So when you use Ionto, typically your electrodes come in a special package. They are different. They have the ability to have a medication in them. They're still self-sticky, generally speaking. And so when you open them up, you'll have one that is a dispersive, and it is just a little bit bigger area than the active part of your medicated electrode. You'll also need to pay attention, very important, that you do not overfill your active electrodes. So on your packaging, they come in different sizes. You'll need to look at what your fill is. So this is a large square and it has a 4 cc fill. I can put up to 4 cc's of medicine on this. I don't want to skimp and only use 2 cc's because then my electrode isn't going to be moist enough on that little gauzy portion. And we know that if it's not moist enough, it's not going to get good contact, and potentially we can cause some skin irritation, burn the patient. It'll be more stingy and tingly than if it's getting good contact and it's completely saturated. So you have to make sure that you're looking at the size of the electrode you're using. It'll always be labeled on the package. You're never going to just see this sitting around with no actual label on it. Once you have it, you're going to take your 4 cc's of medicine. You're going to make sure that it's all your bubbles are out and all that kind of stuff. Please note, there's no needle. Now, I may have needed a needle to get it out of a vial, but I always do that away from the patient. You need to utilize your hands-free technique if you're having to utilize a needle. So if you have drawn out of the bottle and then you're good to go, to recap, you need to do your scoop technique, and then you can tighten it on and take the needle off, okay? That needle is never going in a patient. You can reuse it for that same medication over and over and over again, or you can get a fresh one every time. That's up to you in your clinic. But this is what I typically will bring into the patient's area and just be like, look, there's no needle. We're not injecting it. I've just got to have something to measure it to put it on here for you. So when I do that, I make sure that I'm getting all the way around the outer edges, and that I am getting it nice and saturated, okay? Now, if you overfill it and then you go to put it on your patient, that medicine is going to squirt out, meaning your sticky isn't going to stick to them. If it's not sticking to them, it's not going to get good contact. Again, you can have painful sensations from your patient. So you want to make sure that you are being very careful that you're only using the right amount of fill for the medicated patch, okay? So I've got my medicine on there. I've got my dispersive over here. So the next thing I need to make sure is that I have done all of those pre-modality steps with my patient. So I'm going to introduce myself. I'm going to have checked their chart. I'm going to have done sensation testing at that area that we're going to put it. I am going to make sure that I have done a skin inspection. And with this one, it's really, really, really important that you do a very thorough skin inspection, because after Ionto, you may see like almost what looks like a little ant bite. You know that little white head that kind of forms when you get like a fire ant bite? You'll get a teeny tiny little blistery bubble that looks like that. It may not be white per se, it may just be raised in kind of a clearish color or a very flesh color for them, but that is an indicator of a burn for your Ionto, meaning you delivered the medication too intensely, too quickly for their skin to be able to tolerate it, okay? So that is definitely something to look for. You want to make sure that you clean the skin. So you're alcohol wiping and making sure that you're scrubbing it, not just like, oh, it's white, but I mean like scrub it a little bit to make sure there's no dirt, no oils, that they don't have any lotions or deodorants or perfumes on there, because we don't want to push anything else and interfere with that medication getting down into that tissue. All right, has anybody had Ionto before?
I've seen it.
Yeah, I've done it.
It's not usually super comfortable like the E-stim. It feels kind of like a little,
The burning, tingling sensation.
I've had people tell me it feels kind of like a very mild bee sting, like the stinger's in, but after that you kind of get used to it. So just like you change the intensity on your home E-stim units and you can turn it up to be stronger or turn it down to be less intense, you can do the same thing on these units. Now this one, you can be really, really specific about how much you're turning it up. Some of them just have a button and it goes from 2 to 3 to 4, and that's your delivery rate. I'm gonna deliver 2 milliamps of medicine per minute, or I'm gonna deliver 4 milliamps per minute. Depending on how much medicine I'm pushing in there is gonna determine how much time it's gonna take, because my machine is gonna ask me what my dosage is that I wanna have for the patient. Typically your dosage is gonna be 40 milliamps for dexamethasone on whatever your body part is. Your doctor or your PT generally sets this for you. If they don't, you are more than welcome to use your clinical judgment and your rational thinking and your research knowledge to be able to determine an appropriate dosage, but you still have to fly it by your PT that's supervising you, okay? So if I'm gonna go in and I'm gonna start this treatment, I need a victim, I mean a patient. Ooh, Angela, come on over.
Will you feel the same thing even though it's water?
Yeah, you'll still feel the electricity, there just won't be any medication being
Okay.
delivered. Would you mind having a seat right here for me? Can we do patellar
to you.
tendinitis? Is that okay? All right. So Miss Angela here has patellar tendinitis. We're gonna screen her for any kind of electrical modality, contraindications, or precautions. Can anybody list some?
Metal in the knee.
Metal in the knee,
Pacemaker.
pacemaker, in the knee. Anything else?
Nothing.
Malignancies.
Malignancies. So if she's had like osteosarcoma or something like that. Pregnant in the knee. Here's another one. Just like with the phonophoresis, we have to screen her for allergies
Allergy.
to the medication.
True.
So are you allergic to water today?
No.
Because we're going to treat your patellar tendonitis for hyperhidrosis. And that literally, the treatment is you're going to use a water-filled pad. All right. So I am looking at her knee. It does not appear that there is any blistering or scars that might be more sensitive. Can you feel this the same as you feel that? And may I lift just a little bit to touch the top of your thigh? Can you feel that all right? And does it feel the same over here? Okay. All right, we are going to clean. And then we're going to clean for the other dispersive electrode. Okay. Now I have my medicated patch here, and you can see it's pretty nice and well saturated. I'm going to peel from the corners just like a regular electrode and make sure that I'm not like squishing it on her. But I'm going to ask her, and this is important because this is a very localized treatment for the medicine. Where exactly is your pain on that patellar tendon? Can you point to it with one finger? Right there. Okay. So I am going to aim the center of my electrode on that spot. And I'm going to kind of be gentle as I'm attaching it, and I'm touching just around the edges. I'm not touching right on that little spongy electrode spot. Okay. Then I'm going to take my other one, and I'm going to place it proximal, looking for like 6 to 8 inches away. Okay. Obviously, if I'm doing like up here and I'm trying to place proximal, that's not going to work because I'm not going to put it up on her head and shave her head and make her do that. But like on her shoulder, I could put the active electrode here, and then I could put the dispersive one like rhomboidy upper trap area. That's fine. Okay. So I've got her electrodes set up. Now these particular electrodes have a button type attachment, so you need to make sure that you have a button type attachment for your wires. You'll notice, and I don't know if you can see, the clip is closer to this side than it is to this side. So when you go to clip it on there, I would not put it this way. I would want it to be as low and as flat, so I would be putting it this way. All right, so we're pretending that this is dexamethasone, which is a negatively charged medication. So I am going to use my negative wire and clip it on there, make sure it's on there nice and snug. And then I'm going to put my positive one up here because we're wanting that medicine to repel from this negative wire and push that medicine into the skin towards this one. It's not going to actually travel that medicine all the way up to this electrode, but the idea is the current is going in that direction. Okay. All right. So this is where we get a little crazy. So this is what it looks like. We have it set up here for channel 1. So we're going to just use channel 1. And over here on the top, you'll see that there's an S1, S2, P, and R. S1 is settings. S2 is settings, depending on which channel you're using. P is to program, and R is to run. When you open it up, you're going to open from the bottom, and it's going to look like this. You'll notice this one has tape on it because the instructions are underneath it, and this is the one I use for skills checks and practical exams. But there's another one in here, and it literally will walk you through step by step. You're going to turn it on here, and you should start to see it give you something on the display. When that display comes up, this machine is set to default to 40 milliamps per dose, but you can change that using the corresponding knob. Say I wanted to only do, a different setting. I could go in and I could change that up here. Okay. when I go in and look at what is displaying, I have the ability to go in and change things down here. So if I want to change that dosage, I can hit my down button and I can do a dosage of 20 milliamps of medicine. Okay. For time purposes, I won't do the full treatment, but I will do it at 40 because the math is going to be easier for you guys to understand. Okay, so we're back to 40, my dosage. I'm going to now change my top thing to P for program. And this is going to be the intensity at which the medicine is being delivered, how quickly that medicine is being forced into the skin. I will tell you, start low and work your way up. Typically, I'll start at 2.0, kind of like with the ultrasound, you know, starting at 0.8 and working our way up. I'll start at like 2.0. And then if I deliver 40 milliamps of medicine at 2.0 milliamps per minute, use your big brains. Any guesses as to how long this treatment will take?
20.
Yes, it'll take 20 minutes, okay? If I delivered at 3.0, it would only take 15 minutes. If I deliver it at 4.0, it'll take 10 minutes because I'm pushing that medicine in faster, so it'll take less time. I tell patients, it's just like if I had this and I was putting it on you and I was pushing that plunger. This is how fast I push that plunger, is what I'm setting for how quickly that medicine gets delivered, okay? So once I have that set for my delivery intensity and rate there, then I'm going to turn this knob to R to run. Before I do that, I tell my patient, this is going to feel kind of like a little tingling, stinging sensation. You may feel it up at the top one. You may feel it at the bottom one. You may feel it at both. You may not feel it at all. This is one of those modalities, everybody's a little different. So I like to just prepare them so they're like, I don't feel anything. Because at 2.0, they may not feel anything. We've got it on a low intensity. Super sensitive people might feel it quite intensely, and you may not want to increase that speed for them. They may need a longer duration for this portion of treatment. All right, so are you ready? Do you have any questions? No. All right, we're going to just turn this to R to run, and you're going to see here it's going to change on that screen. So as I turn it to R, it's now going to start counting up, 0.6, 0.7, 0.8. It's counting up to that 2.0 delivery rate. When it gets to 2.0, then it's going to change and cycle to show you a different thing on the screen. That's just how this machine is set up. So we're at 1.8, 1.9. Do you feel anything at all?
Mm-hmm.
Where do you feel it?
I felt it here first before I felt it here.
And then you feel it there?
Yep.
Uncomfortable, super painful,
Mm-hmm.
able to tolerate it?
Mm-hmm.
Do you want to, all right, do you want to try increasing the intensity to increase the speed of the treatment?
Go ahead.
Okay, so you'll see here now it's changed to how much dose has been delivered. So if I want to go back and I want to change the intensity, I need to look under here and I need to change my display. Okay, so I'm going to hit this button and you're going to see it change from the dose down to the delivery rate there. So I'm going to increase it very slowly. I'm looking at my patient to make sure she's okay. You all right?
Mm-hmm.
All right. 2.8. That's 3.0. Is that all right?
Mm-hmm.
You want me to keep going up?
If you want.
No, it's up to you.
I'm good.
Okay, she's good there. So at 3.0, I'm going to go back and hit my little button here again, and it's going to cycle through and show me how much time is left. I'm at 12.5 minutes right now, okay, to get that 40 milliamp dose delivered. This machine is great. It has a really high-pitched, annoying beep that is very long. She'll hear it probably as long as she doesn't have any like hearing aids or known hearing loss. However, you are still expected to set a timer. You are still expected to come and check on the patient. So, all right, we are at 11 minutes, 11 and a half minutes left for your treatment. I'm just gonna close this. I'm gonna set it right here. I'm gonna give you this bell in case you need me. There you go. And I'm gonna be like, she's good to go. Now, can I do other modalities while she's on this?
Yes.
Sure, I could put an ice pack on it. I could put, she could be doing a heat for her back. She could be getting a massage.
Not while she's lying on it, right?
Not on this,
Not on this.
but on something else.
Yeah.
What types of things do we want to avoid after this treatment?
Sun exposure.
What?
Would you want to avoid sun exposure?
Not necessarily. But remember, we've just delivered a very localized medicine right here.
You don't want anything rubbing on it.
I don't want to be rubbing on it. So I'm not going to go and do like cross friction massage or stuff like that because that could disperse the medicine. I want it to sit right there under the skin.
So probably no ultrasound either.
So probably no ultrasound either. Okay, we don't want to do that deep heat to increase circulation, which is going to disperse that medicine. Okay. So she's at 10.5 minutes right now. She's just tingling along. Can you describe it? What it feels like?
Like a stinging pain. Especially I feel like down here, right? I get up above here.
It's like a little, like a pinching kind of like,
Yes.
it's not a tingly, numb,
No.
kind of like my arm fell asleep type sensation
It's a
that you
sharp
felt last
kinda
time.
like-
It's like somebody pinched you and
Yeah.
they're not letting go.
Yeah.
Okay? So I'll tell people, it feels like a little pinch. It feels like, if you've ever had a bee sting, it's a bee sting we can control the intensity of, which is important because sometimes people really don't like bee stings. But I will let them know we're going to do this. The reason why we do this is because maybe you can't take the medicine because you've got like kidney or liver issues and you can't take a anti-inflammatory because it'll be dispersed systemically. But right here in this spot, we are avoiding all of those livers and kidneys and all that kind of stuff. So it might be safer and tolerated better for her. We need to make sure that when we are doing this treatment that she's comfortable. This is not the position I would typically have put her in. I would put her either laying down, like propped with a little bolster under her knee, or sitting in a chair so she has some seat support for her back. If I was gonna put ice on her leg, I would probably have propped it up and draped it across. That's fine too. But I would want my patient to be comfortable because potentially this could be like a 20-minute treatment. And sitting like this, not the greatest posture right now from my view.
Yeah, that's
She's very,
Slouching.
she's also doesn't have any feet support down here, so I would have lowered the table down, things like that, just to make it a little bit more tolerable for you to be in a position to have this attached to you. Now, Ionto is a fabulous thing because you can use a bunch of different medicines for a bunch of different purposes. But the best thing is they make patches that don't require you to have this. They make them where the battery is built in and it has two little wells. It looks kind of like a figure 8. There's a medication well and then there's a non-medication well. And you just put whichever medication on the side that you need it to be on, like one is designated positive, one's designated negative. And so you use the medicine on the one that you need and just saline on the other one. And you attach it to them and it might glow or give you a beep or give you a little light indicator. And when it turns off, it turns off. And they can wear that and go home. They don't have to sit in your clinic. I will tell you, these electrodes are about, so let's see, we talked last week that the other electrodes were about $4.50 a pack. These electrodes are like $7 or $8 a pack. These are single use. I can't reuse this again. The other ones, I can put their name on it and I can use it next time they come in. But these are single use. So it's a little bit more expensive on the cost to the clinic. And that's not something that I can bill the insurance for in addition to the treatment that I'm applying. I can't bill the insurance for the actual supplies that I needed. Shakora?
With the other patches that you were talking about, how does like the settings on it work? Like
It is a flat set. And because they're gonna wear it for a longer period of time, or they can wear it for a longer period of time, it typically has a default that is a slower delivery rate. So you may have to wear it for an hour, or you may have to wear it for, 6 hours, or what, different ones have different delivery rates. You have to really pay attention to the equipment that you're using. But they've made all sorts of different kinds out there. They make them in different sizes, just like this is considered a large at a 4 cc fill. They make them small at 2 cc's or medium at 3 cc's. So it just kind of depends. Things you have to consider is allergies to like the adhesives. So you want to make sure that you're looking at that for your patients. We're at 6 minutes left here for you. How are you feeling?
Starting to hurt.
Starting to hurt?
Mhm.
Okay. So let me turn that intensity down. I'm going to go to my display here so that I can see the right thing. And I'm going to go down here. That's my dose. We've delivered 22.8 out of 40. And I'm going to go to my my current, and I'm going to turn it down. We're going to go back down.
Because it feels like a really bad sunburn.
Uh-huh.
Or rug burn.
Yeah.
Yeah.
So let's go back down to 2.0. Is that noticeably different at all for you?
Yeah.
Okay. So if I go back and I look now, my timer went from 6 minutes to 7.9. And this is something you can continue to adjust, okay? Now, if I was writing a soap note on this treatment, I would put that we started the intensity at 2.0 for a treatment time of 20 minutes. At, 2 minutes in, the patient said that she would be interested in having it delivered faster. We increased it to 3.0, which was comfortable. But at 6 minutes remaining, she requested it to be turned down so that it was less intense. And I would just go through and kind of lay it out that way. Like at 2 minutes, we had it set at this time, and at 6 minutes remaining, so at we had it set at this intensity in time. Because the dosage is still going to be the same. She's going to get that 40 milliamp dosage no matter what, but it's just how quickly we're putting it in there to her.
And what she reports all in the subjective,
Yes.
but in your objective you just put
Yes.
at what time you change the...
At 6 minutes remaining, the patient started to report increased pain or, intense stinging or, bad sunburn sensation at the active electrode. Intensity was decreased to a tolerable level. And then in your objective, you would put the intensity was decreased to 2.0 milliamps per minute for the current. Okay.
And Professor, the iontophoresis can be done at home or has to be done in a clinic? And
it is a prescribed medication for the patient.
okay.
And typically these Ionto machines are not something that you can like go and buy like a TENS unit over the counter at CVS or Walmart or things like that. And the patches are typically a controlled type medical device. So you're ordering them from like, I don't know what it's called this month, but it used to be Salmon's Preston's, and it was Salmon's Preston's Royalian, then it was, I don't know what they're calling them this month, Medline. There's a bunch of different,
Medical supplies?
medical supply
Or-
companies out there that create them. Sometimes even your e-stem manufacturers create their own brand of electrodes. So like MP has some, and Rehabilicare had some, and Zynex has some, and different things like that. Okay. All right. So you're at 5.5 minutes left. That's still good now. Okay. So as we go through and we think about what we would do for our soap note, after we take off the electrode, we need to inspect the skin because we know that she had some discomfort, so we need to inspect that active spot where she was telling us that it was uncomfortable for any type of increased, blistering or anything like that, and it might be very small. Here's the other thing I tell my patients. The first time I do Ionto on them, I will take off the electrodes and do a skin inspection at the facility. But we've all heard of a Nicoderm patch, right? Put the patch on, the skin absorbs it. There's no electricity involved. So we know the skin has the ability to absorb medication through that dermal barrier. So after the first time, and I've made sure that the intensity that I've delivered it at isn't causing any kind of adverse reaction to the skin, I will tell my patient, all right, you're good with treatment, no pain, no problems. I want you to keep that electrode on for a few more hours. Just let the medicine kind of keep soaking into the skin. So we're still getting a little bit of that transmission. It's not nearly at the rate that we push the medicine in with the electricity, but you still can have some passive absorption. That's only going to benefit them if it's if we wind up having a beneficial treatment with a little less pain after that initial visit. Typically with Ionto, you may notice a slight decrease the first visit, but it's one of those things that takes consecutive treatments to get enough medicine into that tissue to be effective. Just like you can't decrease inflammation with taking 2 ibuprofen on Monday and expect on Thursday that inflammation to still be down. No, you've got to get enough built up in your system. That's why they tell you to take it every 6 to 8 hours, anywhere from 400 or 200 to 800 milligrams the doctors will prescribe, right? Same thing with this. You may not notice any change in your pain today, but as long as you don't have any skin irritation, I'd like to try and do 2 to 3 treatments and see if we can start to get that pain to come down. If we are having success and you're noticing a decrease in pain, then we'll continue on for the duration of the prescribed treatment. Typically, we're looking at like maybe 6 to 8 visits, depending on the intensity of the pain, the area that we're doing, things like that. If after 2 or 3 visits we're not seeing any change in pain, then I'm not going to continue to utilize resources and the patient's time and things like that. I'll go back and tell the doctor, like, look, this isn't tolerated, or her skin's having adverse reactions to it, or maybe we need to do something different. Usually patients are going to get Ionto because they're avoiding having some sort of joint injection or tendon injection. I would not appreciate having somebody go and shove a big fat needle filled with medicine into my heel for my heel spur. But I'm willing to try this because it does not involve a big fat needle down in my foot where there's not a whole lot of meat, okay? All right, we're at 1.8. It is very slowly ticking by here. When it gets down to the last little bit, it'll switch that display back over and it'll show you the ramp back down to 0 on the current. So that's something that you may want to warn your patient, like if they're watching what's going on, be like, okay, when it gets close to being done, you'll see it switch over and it'll start counting back down, because they've been watching it either count up on the dose or count down on the time. So I like to just warn them, like, it's not broken, it's doing what it's supposed to do. So this is the complicated machine because you have lots of settings that you can tweak and adjust. They make machines that literally has a wire come on off of it. It's positive and negative, and it's like 2 buttons. There's an on button, and then there's an intensity button, and you hit the intensity button and it goes from 2 to 3. You hit it again, it goes from 3 to 4. You hit it again, it goes from 4 to 2, and you just cycle through. So there are some that are much more plain Jane, that'll only do 1 channel at a time. If I was going to have a patient utilize this, could I do other things